So the question is, how is AI impacting our practice of medicine? I'm a big early adapter on technology in medicine, and I'm using AI every day in treating my patients. And the question that everyone's asking, are the robots, the machines, going to replace humans? And that may occur at some point, but I think at the moment, what I'm noticing is that the AI is making me a better doctor. One of my favorite examples is you need to be a good point guard, where you need to distribute, the tools that you have. You need to be able to lean on those tools at the right moment. I think that's becoming more and more of what's important in being a doctor. For example, one thing I've been using in the last month is a large language model, a HIPAA-compliant large language model through a Doximity app. And we're using that to in patient education, where we're personalizing the patient education, answering the questions they have, and we're able to use the large language model to create a personalized patient education sheet that goes to their cell phone, text to them a link that's HIPAA compliant that they can read later. And patients like the idea of being able to read what their conditions are. One of my patients, a very intelligent lady who's an engineer, said, "I can't believe I've been letting you treat me for 2 years and I didn't really understand what you were treating." And so that's powerful. That's me. I'm using, integrating what the patient needs, and then using the AI to distribute the information that I couldn't do that quickly. We have, patient little handouts, but they're not answering the questions they need. I can specifically answer the questions she has in a much more powerful way, and it's very exciting to utilize this for patient education. The second thing is large language models that they're developing. We're going to be able to incorporate a tremendous amount of information and studies that we wouldn't have necessarily had access to. And again, it's going to be better healthcare for the patients, and it's better for us. And when you start seeing what the AI is doing, it's really filling in the gaps for deficiencies that we had, and it's going to make us better. Now, will the machines take over at some point? Maybe, but I think at the moment, it's still important for physicians to do all the same patient education and information, because the models are still early, and you need to be the filter to say, no, that's not correct. I need to change and alter that. So right now, the big term is augmented intelligence, not artificial intelligence. So we're working together, and I think we're already seeing a lot of positive results, amazing feedback from our patients, especially using the large language models. And one advantage of the large language models in patient education is I can translate this information into just about any language, and the translations are much more accurate with these large language models such as ChatGPT. And patients, great feedback from our Spanish-speaking patients on this patient education. It's been, I think, a game changer.